Hi, my name is Kämmerer from Germany. I am an ITI fellow and I am doing a lot of in vitro as well as in vivo research on bone substitute materials and bone materials for alveolar ridge preservation. Well, some of our augmentations will possibly fail. And I want to help you in order to limit these failures. How? Well, by selecting the correct bone material, the correct bone substitute material for its correct indication. Today, I will talk to you about allogenic bone substitute, which is an interesting and safe alternative to autologous bone. But if, and this is important, if you think about its indications and its limitations. But let's start with bone and bone substitute materials in general. What do we have? First of all, it's the patient's own bone, autologous bone, with all its osteoinductive properties. Then we will have substitute materials such as xenogenic bone, mostly osteoconductive. We have synthetic alloplastic bone substitute materials, also without the osteoinductive features of autologous bone. But you have to keep in mind that harvesting of autologous bone always has the limitation of donor side mobility. The fourth part is allogenic bone, and this is in the center of this webinar today.